Welcome back to another episode of African Farmer Voices. Last week, when I had a conversation here, I was talking about non-market strategies and what pharmaceutical companies would do in the wake of COVID, in the wake of USAID funding freeze that has happened and all that. But I just gave high-level ideas in terms of what can we do and how do we do it. So as a follow-up to that, I had a series of conversations, and this week we had our first members meeting for African Pharmaceutical Network, which I would encourage you to join up and be part of if you're interested in African pharmaceutical industry and looking at how you can work with peers to shape that landscape and also to shape up the opportunities that might arise within the African pharmaceutical landscape. So when we look at that conversation in the members meeting, one of the questions that I was intrigued to hear is that how are we shaping the conversations around access to medicines and what are the key implications of this particular funding freeze that came from the US on the USAID development assistance basically. So from those conversations, some of the key pointers that are coming in, and one of the worrying piece for me is that I've not seen that much of landscaping action that is taking place, depending on the circles that I'm in. I know we're engaging at individual levels, at company level, but then the question is, what is the long-term game plan? And when I talk about these in this particular video with a focus on shaping Africa's pharmaceutical markets in the wake of USAID funding freeze, I'm looking at the pharmaceutical market by the value that healthcare services are predicated on having the right quality health products and technologies, and that includes medicines, diagnostics, vaccines, and all the products that we would use in our healthcare services. So then when we look at that, it means the person who is going to offer those services in the clinical setting, in the healthcare setting, and that would be the COVID. But at the same time, that needs to be funded, that needs to be provided for and actually supplied in a reliable manner. And those are critical conversations that we need to be looking at. Following the freeze, there have been a lot of conversations and a lot of feedback that are coming from different sectors, looking at the number of people who are out of jobs because of that, but also in terms of the impact for the patients who are depending on these programs to get access to their medicines. I feel the pain, and I know people who are close to me who have been dependent on that, whether they are working for USAID-funded organizations or NGOs, or they were accessing care based on those particular services that were there. But the first question that I would be posing, which is not content of this conversation, is why is it that we're in countries where we have parallel healthcare systems? A parallel healthcare system where we have a program funded by a different entity within the same institution, probably public healthcare institution, instead of having kind of a structured mechanism where that cost and that pain is spread across the different departments, and therefore then ultimately in case of such kind of disruption there's no impact in terms of service delivery for whatever is available and can continue. Then we start stressing over how do we get the products coming into the markets. I think that is a question that we need to be asking, because if you're in an institution where you have 1,000 employees and 800 are part of the government system or the public sector, then 200 are program related, it means at point of disruptions like this, the 200 will be out of a job. But they're out of a job, meaning it's disrupting an entire department that was anchored on their availability and ability to offer those services. If that was redistributed and all of the different departments were there, we might have an impact at the high level in terms of the value of return that each salary that each of them are making depending on the cost and the budgetary constraints. But at the same time, the services would still be available. The departments would be running. Now we have departments closed. We have institutions closing doors. That is not a place we should be. And we need to maybe restructure our healthcare systems and see how we deliver value. And it should be guided by the long-term imperative for value of us being self-reliant, self-resilient, and also self-sustainable in our perspective. But that is not the content of this conversation. The content of this conversation today is about how do we shape African pharmaceutical markets. With all this disruption, we know antiretroviral medicine that has been dependent by these programs. We have the global fund funding for TB medication, malaria medication, and related care solutions. If this freeze continues for as long as it might, we're not sure how, 90 days will be coming to an end in the next 1.5 months or so. If it doesn't resume, there will be a pain. But if there's going to be a pain, even without waiting for whatever is going to happen, we need to be asking ourselves, what is the extent of that harm? What is the extent of that impact on our health systems? My first question would be which programs, which disease areas are impacted? In those disease areas, what are the healthcare products and technologies that were reliant on the USAID funding? Were they the diagnostics? Were they the medications? Are they the vaccines? all the different products that were touched across that. We need to be able to quantify and say, these are the products, these are the diseases areas that were being funded. These are the medications and the health products and technologies that were required for that. What are the estimated use levels at any one point in time on a monthly basis, on an annual basis, and what would that look like? I think that would be a starting point for us to be able to quantify the probable impact of it, but also to quantify and establish where are we and what needs to happen across those disease areas and those product areas. And in terms of doing it, I know the government has a responsibility, but also industry players and companies have a role to do it. And that is why when I look at it from a point of shaping Africa's pharmaceutical markets, for me, the shapers of markets beyond the regulators and the government, it is the industry players, the companies, the distributors who are within that ecosystem. You are not only shaping a market for yourself, but also shaping a market where you have opportunity to scale up and grow and deliver value in the long term. And that is why it comes into place. At the moment, our approach in terms of business and our operations within the African landscape has been shifted more on offering a service and working within the established market, which is a narrow purview. It is good because in the immediate, that is what is paying your rent, that is what is ensuring the lights are on the offices, and whatever you're doing, it is amazing. But we need to think on the next level, and thinking on the next level is seeing what are the other alternative horizontal growth and vertical growth pillars that we can look at to address the local needs that are there. So there's substantial need for pharmaceutical industry players and as go different organizations to come into place and see what that's going to look like. Quantify the need and the areas that are impacted. The next thing is looking at the landscape assessment to establish what are the products that can be produced or have been produced in the local context by the local manufacturers, or what products have been distributed by local players who are already in the market who have the capability to continue the supplies and distribution from a market perspective, not from a donor-driven distribution matrix. The sense of that is then we are able to quantify our capacity to offer these products at private sector level, to be able to deliver them in a free market economics. And therefore then we are able to see where are we playing and who do we need to leverage on their capabilities and strength at this particular moment in time. I know the pharmaceutical department within the Ministry of Health of Kenya did some kind of an industry assessment to see which products could be produced and what percentage levels could be done within their own local capabilities. There's much more to be done in that space because that was looking at the baseline. Now we are in a disrupted market, so we need to do it specifically with a focus on the current gaps that are associated with the USAID funding freeze. Once we've done that and once we've quantified and known who can do what and who can't do what, we also need to stretch ourselves by the local industry players to ask ourselves, these are the players who are in the market who can offer these services, who have been playing in those domains. Who among them and who among us, if we are the same players, can pivot and actually scale up in a particular product line? Probably I was doing anti-infectives with a focus on maybe, for example, the antibiotics or whatever. But now I feel like probably I have the capacity, the same manufacturing techniques, the same product processing applications can be adopted in producing some of the antiretrovirals, especially the solid dosage forms. Can I pivot to that line, and what would it take to pivot to that particular line? You'll need to have product development, the formulation development, and all that kind of work. Still, it is something worth considering. But once we've done and stretched to the next level, this is what we are capable of. This is the next phase of what we can do, what we're capable of. It's about looking at what are the key levers of success that will enable you to be able to play in that domain, to close these gaps and deliver that value. It's not going to happen unless there's funding. Currently, the funding has been donor dependent, and all the USAID has been one of the biggest funders. Who are other donors and players within that ecosystem that we can start seeding conversations with to see what alternative funding mechanisms can we bring on board? It can be the funding that comes in terms of scaling up your operations as a company to be able to pivot into these new streams. Maybe those are going to be the catalytic funding from in terms of development financing corporations, grant funding, government concessions, public-private partnership, all that kind of funding to build the capacity to produce at scale of what we expect. On the other end, it could be around funding to actually buy the products and those concessionary funding agreements where we agree, we are going to fund you in terms of setting up whatever you do, raise the money, but we make a concession that we will buy from you. That is the government making purchase agreements and commitments. Those are some of the advances that we need to be considering at this particular moment around funding, but also looking at the alternative funding mechanisms. I know these products have been in the private market, they've been donor funded, and therefore people have been accessing them for free. The question is, can we have a cost sharing arrangement where the government and all those alternative funding mechanisms would cater for a part of the cost, and a partial cost of that same medication would be transferred to the end patients and the consumers who are using the services? What kind of arrangement would that be, and what would be the price level that we are going to? Because ultimately that is what will enable it to be sustainable in the long term from a funding mechanism, people paying for the services they're using and ensuring that sustainability mechanism in a free market does continue where it needs to be. The other piece when looking at these is that there are different enablers or constraints that pharmaceutical companies would have. Whether you are a local manufacturer, whether you are a distributor, whatever it is, you need to have an enabling business environment from a policy perspective. Are there tariffs that are impeding you to be able to supply other regions within the market? Can we look at our diplomatic relations across governments to ensure that we can open up our markets to make us extend that market scope, reducing on the tariffs that would be charged? Therefore, affordability and cost becomes an imperative. Energy levels. Companies need to have energy power supply to be able to do these manufacturing activities. When the cost of power is substantially higher, these companies will not be able to produce them at much. Therefore, this is an opportunity to negotiate and see, can we get these special economic zones or whatever production facilities that are listed to have kind of subsidized rates for power and also reliability of that power, so that then they are de-risked from any power outages that might impact their production capacity. That would be a game changer, and that can also ripple out to other sectors where the energy producers can see that there's an opportunity for them to scale up their production level, and with scaling up production levels, we are powering up another ecosystem, and that power can be used in other domains beyond only the healthcare space. So that is an opportunity. That is from a point of looking at the enabling ecosystem players, the infrastructural requirements, that is power, water supply, road network if necessary to look at that. But the other piece is looking at the trade and the excise duties and the financial policies within the country. From a monetary and fiscal policy perspective, the taxation that is going into companies becomes a pain point. And that is why companies would weigh options. Do I want to employ 100 people, or do I want to employ 50? Because when the cost of the labor cost is substantially higher because of the taxation regime that is in the country, it impacts the ability of companies to employ more. If they can't employ more, they can't produce more. They can't produce more, then they can't supply the needed market. Then they get into a vicious cycle where we are never able to get out of the challenge and the pain points that we are dealing with. These are opportunities for us to engage. And how do I look at this shaping the Africa's pharmaceutical market? If pharmaceutical industry players come into the conversation with clarity on what are the key constraints within which we are working, what are the key enablers that governments need to bring into perspective for us to unlock that value, from a regulatory and policy perspective, from a financing imperative, but also in aggregating them with a vision of what do we want for the industry today, a year, 2 years from now, or in the long term, 5, 20 years, 30 years. That is going to be a game changer. And it is a game changer because we are laying the foundational principles that will ensure self-reliance in the long term, but also will stimulate economic development in our markets. And it is my hope that the pharmaceutical industry players, whether local manufacturers, distributors, or the different players within the ecosystem, can look at these to the next level. One question that I've had in some of the conversations as well is that in all these assessments that I'm looking at in terms of landscape scoping, who is going to do it and who is paying for it? I think it's time for pharmaceutical companies and the different industry players from a private sector perspective to work within the trade associations and industry groups to contribute and fund such kind of initiatives. It needs to happen. Why does it need to happen? This is going to shape the market that you want to play in. Do you expect some other people to shape the market and actually create the market for you? Probably not. And I don't think that is going to be happening. So if the longer we wait for somebody to fund it, the longer it will take for such a thing to happen, or it might never happen. If it doesn't happen, you don't have a market, but you're also not addressing our underlying systemic shortcomings and failures as an industry. This is how I feel we need to shape Africa's pharmaceutical markets, and I believe this is a kind of a trigger point for us to reimagine our future. If you enjoy the conversation, subscribe to the channel, connect, share some of the questions that you have. Let's see how we can make a difference in the continent. Thank you.